So I'm going to get started, and I'm going to be very brief in my comments, and then we'll get to the speakers today, which will include Supervisor Nathan Fletcher, the co-chair of the Board of Supervisors Subcommittee on COVID-19, Dr. Wilma Wooten, our Public Health Officer, and Dr. Eric McDonald, the Director of the county's Epidemiology and Immunization Services Branch. I do want to start by talking about our positive case numbers. As you can see on this chart, our numbers are rising, but they are not yet to the level of other areas. We're only 19 days into this in San Diego County and have yet to hit that exponential surge other communities are experiencing. However, don't let that lull you into complacency. We are merely at the doorstep right now. I know people have asked about how long this is going to last, and the reality is that we are still at the beginning stages of this crisis. We have a long way to go, but it's up to us how soon this ends. That means continuing to practice social distancing, washing your hands, and staying at home. Every little action counts now in our efforts to slow the spread of this virus and avoid big spikes in case numbers. I know it's been a challenge, but we can do it. It all starts with you. Keep it up, San Diego. And with that, we're going to get right into the speakers. Our first going to hear from Supervisor Nathan Fletcher, then Dr. Wooten, then Dr. McDonald on the latest numbers and our efforts to stop this crisis. Thank you.
The United States is now leading the world in positive COVID cases, and we have seen the exponential growth in many regions throughout the United States, and we've seen the negative impacts that has had on their healthcare system. The reality is we don't want that to be us in San Diego. As the chart you just saw indicates, we are in the early days of our community spread relative to many of those other jurisdictions. And in the early days, our actions are most important. They are most critical. The things that we do day in and day out over the course of the next few weeks will determine our trajectory at the tail end of situations like you see in other places where they're having great problems. And that is why we are reiterating to the public the essential nature of the directives that have been given around physical distancing, around personal hygiene and hand washing, around what to do if you are sick. Here at the county, we have launched all of our efforts with three kind of core things in mind, very straightforward. First, actions that are taken before the curve. This is our engagement, which started early in January, our public health declaration, a state of emergency, which was before we had a single positive case, and the things that we continue to do to this day, securing hotel rooms for isolation, installing hand washing stations, ramping up and trying to get more personal protective equipment from the state, from the feds, buying it on the open market, deploying hand washing stations, supporting homeless shelters, and so much else. The second part we do is the efforts around flattening the curve. These are the public health orders, closing schools, non-essential businesses, limitations in public gatherings and mass gatherings. These are all of the things that we need the collective buy-in and support of the public on. And then the third thing, which we talked about a bit yesterday, is efforts to raise the bar of our healthcare system capacity. This means getting more ventilators, better optimization of healthcare facilities and hospitals, the incredible work that they are doing, along with things that we can do here at the county to increase the availability and supply. And if we together do all of these three things, actions ahead of the curve, flatten the curve, raising the bar of our healthcare capacity, then it is our hope that we can make our way through this and protect our residents as best as possible. I want to quickly show you the graphical display of the cases that we are facing, we are reporting right now. You can see the current reporting is 58 new cases, which was posted last night, brings us to a total of 341 total cases in San Diego County of San Diego County residents. And then the next slide reflects the number of tests. Again, this is not the total number of tests conducted, as in the early days many tests were not reported to us. We are seeing increasing in testing and increasing in reporting of testing. You can see there are 1,087 tests reported for March 25th, which brings us to 5,055 total tests that we are reporting in the County of San Diego. We continue to take action to get as much testing capacity as we can, both internally into the county and in partnership with our community testing, with the private labs, and with everyone else that's out there. Now I will turn it over to Dr. Wooten for her Public Health Officer's report. Thank you.
Hello, everyone, and welcome, and thank you, Supervisor Fletcher. Thank you for the opportunity to share information with you regarding COVID-19. It is now day 8 since the governor's executive order to stay at home, and we are about 3 weeks into reporting our first COVID-19 case. I would like to thank all media outlets for assisting to get the message out to the general public, and thank all individuals, organizations, and businesses for doing your part to support actions given during these extraordinary times. Supporting the executive order to stay at home and adhering to the social distancing orders helps to slow the spread of COVID-19, and it helps to save lives. The global, national, state, and local numbers for COVID-19 cases and deaths continue to increase. Globally, the COVID-19 infections have resulted in approximately 577,000 cases, which includes 25,000 deaths. Nationwide, there are over 99,000 positive cases and 1,400 deaths. The United States has now taken the lead of all countries currently with the greatest number of cases. As of close of business yesterday in California, 4,040 positive cases, which includes 82 deaths, have been reported. As of close of business yesterday, there have been 341 positive cases reported for San Diego County residents. This includes 3 deaths. Of these 341 cases, 216 or 63% are between the ages of 20 and 49 years of age. 134 or 39% are female, 207 or 61% are males. 69 or 20% of cases have been hospitalized. 31 or 9% of cases have been admitted to the ICU. And unfortunately, 3 or 1% of the total number of cases have died. As of close of business today, the county will additionally be reporting 2 deaths. One is a male in their mid-50s, and the second is a male in their early 80s. I also am reporting that in tomorrow's results, we have a young adult who died in Riverside, but is a resident of San Diego County. COVID-19 was confirmed by autopsy. And again, this death will most likely appear on tomorrow's end of the day report. I would like to express my sincerest condolences to all of the families and friends of the individuals that we have reported who have died as a result of this illness. The information shared today provides evidence that COVID-19 affects everyone at all ages. Also, as a reminder, the health officer's orders issued last Friday includes a directive to stay home and stops the spread of COVID-19, which again saves lives. Lastly, we have received a number of questions related to congregate living facilities. I'd like to confirm that at least 11 facilities throughout the county of San Diego have reported cases of staff, residents, and in some cases both. Of these 11 facilities, 3 facilities have been determined to have confirmed cases. 5 facilities have not had any confirmed cases, and 3 facilities we are waiting on the results. Keep in mind that each year during influenza season, we have anywhere upwards of 40+ influenza outbreaks in our congregate living facilities. And we have developed a protocol based on the protocols we use for influenza outbreaks to address COVID-19 outbreaks in these facilities. Dr. McDonald will discuss this in more detail shortly. The only additional information that I will provide is that the El Cajon Congregate Living Facility has had positive cases in staff and residents, and our staff is following our protocol to work with facility staffs to assess all facilities that have cases or individuals that may have COVID-19 symptoms. And we are working with these facilities to evaluate their staffs and residents and to train staff to ensure proper infection control and prevention. Now please welcome Dr. Eric McDonald.
Thank you, Dr. Wooten. Actually, I have 3 areas that I'd like to cover, and I'll finish with the comments about the skilled nursing facilities. First, I'll give an update on Miramar. The federal quarantine operations have wound down at Marine Corps Air Station Miramar. All of the guests have returned home after 14 days of quarantine, both from the air station itself and from the healthcare location for COVID-positive patients that was maintained off base at the Ramada Inn. The Assistant Secretary for Preparedness and Response, or ASPR, announced today that one of the Grand Princess cruise ship passengers who was under federal quarantine died last night at a local San Diego hospital. He was 86 years old and was not a resident of San Diego County, and his death is not reflected in the numbers that Dr. Wooten presented earlier. It can be very confusing how cases are counted, and across the country there is a system for assigning deaths to where the individual lives. So even though the Riverside County case that Dr. Wooten mentioned was announced by them and is one of our residents, is going to be counted under our statistics, and this case, who is not a local resident, will not be counted in ours. We would like to express our sincere condolences to the family, friends, and loved ones of this individual. And I know that I speak frankly for the entire team of federal and local partners who were supporting the Miramar federal quarantine effort because they feel the same way. There are only remaining 3 individuals from that quarantine currently in San Diego County hospitals, and I don't have a specific status on those individuals to update today. I'd like to give a brief update on cruise ships in the port of San Diego. The Mastam is currently disembarking passengers at the port. All passengers have been screened and are healthy. There are no reports of respiratory illness for the crew or passengers on the ship. We expect the 500 leaving today and the approximately 300 leaving tomorrow to be rapidly transiting to their homes across the country and to remain in their homes for 14 days, as is recommended by CDC after being on an international cruise. This is actually a precaution since most of these individuals, in fact all these individuals, have been at sea for greater than 14 days, and that is essentially a quarantine at sea without illness. The Celebrity Eclipse is due next week. We are in daily contact with the ship. All passengers and crew are well on that ship. There are no reports of respiratory illness and no reports of COVID, and we would expect also that those individuals will rapidly transit through San Diego to their homes. Another update is that the Disney Wonder docked today because they had one ill crew member who was disembarked to a local hospital. This individual has influenza pneumonia and is pending further evaluation. This individual will be checked for COVID-19 as a precaution. A San Diego County resident who was a passenger on the Disney Wonder and disembarked when they were in port previously, subsequently was evaluated in a local hospital for COVID-19, has been admitted and in fact diagnosed with COVID-19, and there's a new update from previous comments here with our daily briefings. I do want to spend a minute or two to discuss how we respond to reports of infectious disease in congregate living facilities, including COVID-19. Congregate living facilities would be long-term care facilities, skilled nursing facilities, and senior care centers or assisted living facilities. First, we absolutely understand the interest and concern for residents in these facilities because they represent a particularly vulnerable population. It is because of the concern of this population, that the Dr. Wooten's health officer order from March 16th specifically limited all visitors to these facilities except under very, very limited circumstances. We have often reports of influenza-like illness or respiratory disease that come from these facilities. We routinely deal with that throughout the flu season. As Dr. Wooten mentioned, we've had actually 59 outbreaks of influenza this season, and 93% of them were in skilled nursing facilities. So we regularly go to those facilities and use a standard approach to evaluate them. It's important to know from the beginning that that licensing and for and oversight of long-term care facilities specifically is a state function, and specific infection control practices have been developed by CDC and CDPH to give to those facilities, and we work with them to ensure that they are followed. At the local level, our local facilities are very well grounded in these practices and are familiar with dealing with respiratory outbreaks. For example, again, we've had over 50 outbreaks so far this year, and I think I have a graphic I'm going to put up to just talk about briefly what our procedure is. There we go. The procedure for responding to an outbreak would be to work with the staff and administration to isolate ill individuals, to conduct contact investigations among both staff and residents, and then to work with the facility to keep patients, staff members, and family updated so that they're aware of what's happening. Some of the techniques that are used include cohorting patients who have similar illnesses together, ensuring that the diagnosis that's been reported is in fact correct, and as you've heard, some of the reports we've received so far of possible COVID like symptoms and indeed turned out not to be. Some of those turned out to be flu because, again, we still have a lot of flu in San Diego. And you can probably take that back down, okay? And we work closely with the facilities to be sure that they are following the most up-to-date guidance, that they have the staffing that they need to be able to conduct good infection control, and the equipment that they need. We actually meet regularly with the infection control staffs of these facilities. In fact, the last meeting was a virtual meeting held this morning to give the most up-to-date information and to make sure that those who are at those facilities understand how to contact our EOC to be able to meet any supply needs that they may have. So I want to assure you that we're very familiar and work closely with these facilities, hand in hand with the California Department of Public Health Hospital Associated Infection Group, and also the licensing authorities who are here in San Diego to make sure that all protocols are being followed. Now, I know there'll be lots of questions perhaps related to very specific aspects of what we do, and I want to let you know that we're putting together a FAQ sheet that will answer in, I think, much more great detail than we can do in a venue like this, what's going on. So I'd like to turn it over now to Supervisor Fletcher.
Thank you, Dr. McDonald. We're going to quickly go through a couple of the metrics. We will start with the first slide on personal protective equipment. This is a quick update encapsulating actions to date, 428,515 N95 respirators, over 100,000 surgical face masks, and you can see on down the line, over 580,000 individual pieces of personal protective equipment has been delivered to our partners throughout San Diego County. And again, we work every single day to get every available piece of PPE we can possibly get our hands on through state supplies, federal supplies, commercially available supplies, volunteers fixing masks that still meet the threshold of what we need, and we will continue to do that. On the motel room situation, these are very important for what we believe is coming with a significant increase. Having a stockpile of available rooms for folks who test positive or PUIs, those continue, 1,810, 85 occupied. The Regional Task Force on Homeless Rooms are for individuals who are particularly vulnerable but not showing any symptoms, and we are in the process of moving a couple hundred more rooms their way. The third slide on our outreach efforts, We are now pushing about 58,000 calls to 211, 1,437 to our nurse triage line. That is a staffed line at 211 with nurses. If you do not have a healthcare provider or cannot get a hold of them, you can call 211 and talk to them. Hand washing stations continue to be installed. 1,825 hygiene kits have been distributed to our providers and partners and through our homeless outreach teams. And porta potties are in the process of being set up and installed along with receiving additional requests. And we will continue to keep you posted on all of our progress every day. Thank you.
Thank you, Supervisor. We're going to go now to the questions. And again, if you aren't identified by name or your outlet when your name is called, we would ask you to do that and then state your question.
10 News, please state your name and question.
Hi, this is Mimi Alcala with 10 News. We're hearing that the 17-year-old in Lancaster who recently died was initially turned away from an urgent care clinic because he did not have health insurance. Is there anything being done locally to make sure that doesn't happen to people here and they can actually seek COVID-19 treatment regardless of their health care status?
Okay, we'll ask Dr. Wooten to answer that question.
If I understood the question correctly, someone went to an urgent care and was turned away because they did not have insurance. Is that the question?
Yes, did not have health care insurance. He was turned away and taken to a hospital where he died a few hours later.
Okay. Well, individuals in that particular situation, it certainly is unfortunate that the individual passed away. And emergency departments, whether someone has insurance or not, obviously are obligated to take care of individuals. And apparently the person was taken to the emergency department, and their condition was severe, where they did unfortunately expire. And what has to be determined is what was the cause of the person's death, and that case would most likely become a medical examiner's case, so that the cause of death could be determined. In general, if individuals do not have insurance, there is also the county's phone number that we can provide you so that people can call, or they can call 211. That's probably the easiest thing to do, is to call 211. In this particular situation, that may not have been beneficial, but if individuals in general do not have insurance, they can call 211 to get assistance and determine if they are eligible. I see a lot of people lining up, so please take it.
No, again, I think I heard the question correctly. First, it was not a situation that occurred in San Diego. Is that correct? Okay. So again, people who need emergency care are not going to be turned away from an emergency department. I'm an emergency physician by training, and that is just not going to happen in San Diego. So if someone was referred there, we don't know the real circumstances, frankly. I think really people need to be assured that in San Diego County, people who need emergent care are going to get it.
So if they were to show up to an urgent care clinic with all the symptoms, they would not be turned away?
Again, I need to understand, I need to understand the specific circumstances. Again, when somebody presents to a specific facility for care and it's not emergent, there's usually a process for them to determine whether that is an appropriate place for them to be cared for. For example, if it's an insurance-related thing and they don't have insurance for that facility, they may be asked to go to another facility. The good news is in San Diego, we have a very good mechanism through 211 for individuals who don't have insurance to be able to access clinics where they will be accepted for care.
Okay, let's go to the next question.
iNewsSource, please state your name and question.
Hi, Jennifer Bowman from iNewsSource. We saw the model you provided this week showing our hospital capacity. I'm wondering if you can provide additional details about the county's efforts to add hospital beds to our local system, and whether y'all anticipate other facilities to be used for, some type of field or makeshift type of hospitals.
Okay, I'm going to ask Rob Sills, our Director of Medical Operations Center, to come up and answer that question.
Hey, good afternoon. Yes, we are looking at all avenues to increase the capacity in our healthcare system. We currently have on order the federal medical station that I've spoken about before. That's a 250-bed capacity, and then we're looking to put it into a shell so that it'll increase the capacity for our total bed count within the county. And then we have a couple of more things that I'm looking at for further down the road in case they're needed, so that we are building for that, yes.
In addition to the potential placement of a mobile field hospital, which would actually increase the number of available rooms, we are taking a series of steps for things that we can increase occupancy in existing rooms. We mentioned previously we're working with UCSD on taking a dorm, which is empty, creating an alternate care setting, would be staffed with some doctors and some nurses. This would be for individuals presently in the hospital who are too sick to go home, but don't need to stay in the hospital. If we can create new rooms, we can transfer those folks there, which is freeing up an existing room. So I think if you think about the strategy, it's two things. One is how do we increase the number of available rooms, things like establishing a mobile field hospital and some other things. And then the second way to think about that is how do you increase the availability or occupancy or lower the occupancy of existing rooms. And those are things like the alternate care centers, reducing elective surgeries and all of that, so we have more hospital capacity available for folks who need it.
Okay, next question.
NBC 7, please state your name and question.
Hi, this is Claudia Stefanian over at NBC7, and, apologies if you guys already have these numbers updated, but taking a look at the current rooms that you guys are working with, specifically those that are designated for the homeless, it has listed yesterday about 216 and 154 are already occupied. It seems like you guys might already be, losing room for the homeless. Was just curious if that's of concern to you, and what efforts you might be looking into next.
Supervisor Fletcher will answer that question.
Can you just restate what the concern might be? I didn't get that part.
Oh, just that 154 rooms are already occupied at this point of the 216. Am I reading that correctly?
Yeah, that's why we're going to move them 200 additional rooms.
Okay, so that would be the next step, is moving them into 200 additional rooms, correct?
Yeah, and we will, and it is important to note too, and just to put this in context, the public health rooms are available in anticipation of a surge in positive cases in individuals who don't have the ability to self-isolate. And so the fact that that number occupancy is low presently tracks our current kind of positive tests. But as that increases, as we know it will, then we expect those public health rooms to continue to increase in occupancy. The RTFH rooms are for non-symptomatic folks who are vulnerable, and so we are working with them both to give them some of the rooms we've gotten, along with helping them acquire their own stockpile of rooms that they can use for that purpose. And that is in conjunction with the efforts that's happening at Golden Hall and the Convention Center to expand the sheltering capacity. And so all of these kind of pieces fit together in a kind of comprehensive approach to serve not only positive tests who need isolation, but the homeless population in general.
All right, next question.
Union Tribune, please state your name and question.
Hi, this is Kelly Davis. In a March 25th press release, Dr. Wooten said that testing is primarily for people at higher risk of complications, and not everyone needs to be tested. When I asked the San Diego Sheriff's Department about their guidelines for testing inmates, they pointed me to that March 25th press release. So right now there are no national guidelines on testing folks in prisons and jails, but there are corrections experts who are saying that jail inmates showing symptoms should be tested given the jail setting and the high risk of disease spread. So my question is in San Diego County, what should be the testing criteria for jail inmates?
Okay, Dr. Wooten.
Well, jails are congregate living facilities, so we would follow the same guidelines that we would in other congregate living facilities. Because we don't want to have a large, widespread outbreak in jails, detention facilities, or other congregate living facilities. So again, we would follow those guidelines. And what has been stated before and what CDC is recommending is that individuals that are vulnerable, our healthcare providers, as well as our first responders, individuals with underlying medical conditions, compromised immune systems, and older adults. All of those individuals are prioritized, and also our long-term care facilities. And even though sometimes the guidances don't explicitly call things out, as we've been saying, you have to use common sense, and we would include our detention facilities in the population of entities that we would test.
Thank you.
All right, next question.
Union Tribune, please state your name and question.
Hi, it's Gary Warwick. Question for Dr. McDonald and Supervisor Fletcher. Dr. McDonald, I know you've been keeping an eye on some clusters that have been identified, looking at people who might have some symptoms. Anything new to report there? And also for Supervisor Fletcher, any update on the convention center? How many beds it might have, when it might open? And I was also wondering about the vulnerable population that's out there among the homeless. Any idea how many people who are homeless would be considered vulnerable because of their age and because of underlying health conditions they have?
Okay, Dr. McDonald.
Sure. Thank you for that question. Again, one of the things that we do in epidemiology is to try to link cases so that we can identify connections that might help us with public health impact, and also to identify close contacts. That's the reason that we look for clusters and try to draw a circle around it for close contact control. Now that we've moved on to essentially a stage in which there is a fair amount of community transmission, it's not as important to specify specific clusters and give updates day to day on how many people are in each cluster. Again, we mentioned a travel-related cluster early because we wanted to emphasize the travel aspect of it, but at this stage of the outbreak, because of the community transmission, it really isn't helpful to dwell on specific details, and it's information that we get from confidential medical record reports to us. And so the reason that we report is for a public health concern or notification, and in this case, the notification around those clusters and to the general public is the same, which is to stay home especially if you're sick, and conserve the need to go to medical care for those who only need medical treatment, and those who need to be tested. So I'm not trying to dodge the question in the sense that I'm not giving you specific numbers, but it really isn't of public health importance for us to be dwelling on that kind of a numbers kind of update day to day. And the other question, I think, was for the supervisor.
We're working closely with the Regional Task Force on Homeless in the City of San Diego on the Convention Center, making sure our efforts are integrated or coordinated. There's health screening. There's also behavioral health services. And so I know that things are moving rapidly down that front, but it really is their RTFH's announcement to make on the numbers that are opening and what date that will happen. As it relates to the second question in terms of the, it's just generally accepted that unsheltered individuals are more vulnerable just by nature of their condition and their status. And so what we're doing is working closely with the Regional Task Force on the Homeless to identify those who are most vulnerable. Their HMIS system has a ranking and a tracking system that helps identify those individuals. A lot of the data that's come back from point-in-time counts, which has been integrated into that system, allows us to kind of sort and prioritize who are the most vulnerable and help them access the rooms that are available. It's also important to note that your age really is a relative number. One person at age 60 and someone else at age 60 could be in very different physical states associated with that. And often what we see with our unsheltered population, especially those who have been chronically homeless, is that their physical condition matches an age much greater than the number of years that they've been alive. And all of those factors are taken into account, both their age along with their health conditions and underlying conditions, to try and get the most vulnerable into the rooms fastest while we work to expand that capacity.
Okay, next question.
Hi, caller. Please state your name, outlet, and question.
Paul Kruger from NBC7. I just want to be sure you hear me because I called in late.
We can hear you loud and clear. Go ahead with your question.
Okay. My question is this. We confirmed today a case of COVID-19 at a local shipyard. So I have a question and a follow. My first question is, are you aware, and this was confirmed by a spokesman for the shipyard, of the existence of that case, and if so, what are you doing about it? And then I'll have a follow.
Dr. McDonald answered that.
Sure. It's a good opportunity for us to talk about what our actual procedures are when we identify a case at a specific school or employer or a healthcare facility. What we do is we work with that facility to identify close contacts, and we usually provide the employer a template letter that they can use to then notify their employees. Again, the most important notification when you get a positive test result is to go to the patient, okay? And the next is to go to their close contacts, and often the best way to do that is through the employer. And we let them release the amount of information that they wish to announce to inform individuals who may have been exposed. We don't embellish on those announcements. Again, we are a resource for those individuals, and we are, of course, dealing with specific individuals in a confidential way to do the assessments and notifications that are required. And so that's the normal process. And so I don't really want to be talking about specific locations that have given specific information. That's really up for them to decide. Some of those may be, in fact, more than one case. And that is sometimes how you get details on increased number of cases at a specific location. But because information comes to us in a confidential manner, it is much better for that type of information to be released by the organizations and the individuals themselves who are affected.
Great. Thank you for that. My follow-up is this acknowledgement of a case at a shipyard raises a generic, interesting question that I wouldn't expect you to answer to the specific employer. But this is a workplace situation in which people cannot social distance because of the nature of their jobs. They must not be the only workplace that is considered essential and is in fact working now, where workers can't be 6 feet apart. What do they do? Do they have guidance? Do you work with them proactively to come up with other ways to contain the spread of the virus?
That's a great question. I think that each organization, as we have tried to adapt with the challenges of maintaining social distance, including the county here, that's why we're having this particular venue this way, refines the ability to, in fact, achieve social distancing in their work environment. A large organization has occupational health, and occupational health physicians specifically are actually aware of the workplace conditions, the types of work that needs to be performed, and aware of the guidance that CDC uses to be able to minimize risk in those situations. Those occupational health physicians are in fact best positioned to make those types of workplace decisions, and we, of course, are a resource for them to use along with guidance that CDC and CDPH gives.
Great.
Okay, that completes the phone-in calls. If there are other calls of the media that you want to make, go ahead and make those now, but we're going to go to the text messages or questions that we've received, and we'll go with the first one, which I think is going to be answered by Rob Sills because it deals with personal protective equipment.
All right, thank you, Chairman Cox. This question is from Marilee Moore from Fox 5. Today, nurses at UCSD and Hillcrest protested over not having the protective gear they say they need to be safe when treating COVID-19 patients. They specifically called on the local and state government to help provide them with N95 respirator masks. Can our local nurses expect to get these?
Yeah, thank you. We get that question some. And the Medical Operations Center has pushed out all the guidelines from CDC as well as the California Department of Public Health to all of our hospitals and incident command. And we have discussed that. In fact, this our call earlier this week, we talked about the extending the use and the ways the CDC and CDPH has allowed us to use N95 respirators. And on that call, I asked each of the command centers, their emergency managers, do you have what you need? Are you getting what you need? And the answer was yes. And we are in daily communication, and we monitor the usage as well as the need on a daily basis. And those needs, as we showed earlier, we push out the resources as we get them. And to date, we have not turned down any of those to any of our hospitals. So, thank you.
Next question is going to be directed to Dr. Wooten. Go ahead and read the question, please.
Yes, this is from Monica Dean at NBC7. There are actually two questions. Are you tracking recoveries? And if so, what percentage of positives have you recovered?
So, if I understand the question, what we have shared with you previously or will share with you is that in average, it takes about 2 weeks to recover from COVID-19 infections, unless there are, of course, complications. In terms of calling each individual, number one, everyone who has COVID-19, we won't know, but of those that tested positive, we are guesstimating that it takes about 2 weeks for their symptoms to resolve, and we will create a graphic that will show that information going forward.
Also, what percentage of San Diego County do you estimate has been tested?
Oh, that's a question we could guesstimate or estimate that, but I can't really answer that question. We have had limited testing because of the capacity of test kits. We do know that we are increasing our capacity. As of yesterday, we are now able to test with the Abbott M2000 platform, and that is increasing our testing capabilities to run 120 specimens in a 24-hour period. So, and then in about 3 to 4 weeks, we hopefully will be able to bring on the Hologic genomics platform, and that will allow us to run many tests, upward of 1,000 tests daily. So we are just getting, probably now, as I stated before, we are 3 weeks into, just a little over 3 weeks into testing. And, but we can't test everyone. Because of the decreased capacity of testing, we have prioritized our testing to the priorities that I listed earlier. So until we are able to get more test kits across all of the various platforms, we won't be able to have a very robust or increased testing capacity.
Okay, and this one is related. This is from Paul Sisson with the Union Tribune. What is the aggregate testing capacity of San Diego County today, and how has that changed in the last week? And has the reagent shortage gotten any better?
So in our presentation to the Board of Supervisors on Tuesday, we shared that we have 3 buckets of testing capacity in the County of San Diego. We have our public health laboratory, and we have 3 platforms that I've just described. Then we have our hospitals, and 6 hospitals are currently testing, and there's a 7th that should be on board, if not already on board, early next week. And then the 3rd bucket or capacity is through our local or rather through commercial laboratories. And that bucket, if you will, those specimens that are sent to commercial labs, that includes Quest and LabCorp, those tests actually have to be sent out, and it takes a little longer than if they would be performed at the, some of the local hospitals and our public health laboratory, upwards of anywhere from 5 to 7 days. For our public health laboratory, 24 to 48 hours, but in most cases, it can be within 24 hours.
And I have a question from David from CBS 8. Can you tell me the demographics on the Riverside death, and why are you waiting until Saturday to add that death number to your total count?
Well, we were just informed about that today, and it actually was released by Riverside County today. So in terms of our counts and cases, by the end of today, I shared with you the 2 new cases that will be on today's report. We will most likely be notified of this case tomorrow, so it will be on tomorrow's report. Yeah, sure.
If I can elaborate on that too, again, there are lots of questions about numbers. And I'm sorry, I'm going to look over here. Questions are always coming from over there. I apologize. There are a lot of questions about numbers. You may realize that we release a weekly flu report that showed, for example, that we're over 20,000 cases this week. We've had 98 deaths from flu in San Diego County and 59 outbreaks. We normally are in a rhythm to report on a weekly basis, and it allows us to get the report, to make sure it's correct, to verify it, to make sure that the county of residence is correct. And when we're reporting cases on a daily basis like this, our procedure is to, and most of the lab tests come in sometimes at 8 or 9 o'clock p.m. We do a evaluation of the tests that come in the morning. We go ahead and go through a procedure of verifying that they are or are not our residents, or are they double counting, to be able to give the most accurate information at the end of the day, which is unfortunately after this press conference. So I know it's frustrating that sometimes we make announcements here that don't show up in our actual numbers that we put on our website until a day or 2 later. It's because those numbers are preliminary, and we wanted to get the information about this very unfortunate resident in San Diego who died in his 20s with no previous medical conditions out as soon as possible. This individual was from San Diego but was in Riverside, was a death at home, had to be evaluated by the Riverside medical examiner, and that information had to come back to us to be able to include in our statistics. Because literally the results on that test just came back in the last couple hours, we wanted to get that message out now, but that number will show up, and we ask for your patience for us to be able to do the verification of these as we get more information.
Okay, I believe we have one final text question, and this will be to Dr. Wooten.
We do. And this is from Jennifer Kastner with ABC 10. In regard to the Rancho San Diego Assisted Living Center, the facility has reported that 4 staff members are positive. I believe Dr. Wooten just reported that there's been positive cases among staff and residents. Can you please clarify, and are there any updates about Stellar Care Assisted Living Center?
So the name, well, what I will say in general is that we try not to give information about the specific facilities. And, but I will say that Stellar Care is one of the facilities for which we are waiting on test results to return. And what was the name of the first one again?
Rancho San Diego Assisted Living Center.
So we will have to get back with you to provide details. If that information has been submitted or reported to our epidemiology program, our staff, as Dr. McDonald stated, are verifying if there is any truth to the rumor, and they are calling the facility and contacting individuals that would have information to help us verify if indeed. We would also be checking, well, there are several ways. We would be checking our test results and verifying if the results are from an address for the specific facility. So it takes time to conduct these types of investigations. So we can get back to you unless Dr. McDonald has information about that case.
Yes, and she just followed up with a correction, La Vida Real in Rancho, San
Yeah,
Diego.
so
Yes.
This is a great example as to why we have to be clear about, it's a great example of why we have to be clear about the facts when we're asked in a venue like this. Again, that's why we don't want to give out facts that are incorrect. The bottom line is that we have specific facilities who release information, usually in cooperation with us, to provide the data to their staff and to their clients and their, or patients as the case may be. So it's very hard to respond in real time to sort of these kinds of comments, except to say that we can say that something's under investigation, that there are cases there, and that we're trying to respect as much as possible the privacy of the individuals involved, because again, that data comes to us confidentially, and for us to specify whether it's a staff or a visitor or a resident or some other category of individual who's in an organization is frankly too much information that could identify an individual. And so again, why we release information in public health is to have the public act. And the message is still the same as I mentioned before, which is if you have symptoms, you absolutely must self-isolate. The safest thing for you to do is to be at home and to assume that if you're having close contacts with lots of other individuals who are ill, that you may be exposed. And if you come down with symptoms, you should self-isolate. And so it's useful in specific circumstances to let specific individuals know, but we're doing that when we make close contact investigations. And so I just want to go back to that principle and really steer you away from focusing on whether it's 5 or 6 people in a specific group.
Thank you, Doctor. That completes our media calls for the day. But before we leave, I wanted to acknowledge that obviously we're heading into the weekend. And parents have been doing a great job in regards to working with their children, educating them at home and entertaining them also at home. But by now, you may be looking for some new ways to engage your children. I wanted to let everyone know of a new resource that the county has made available and we're providing to help families and really all San Diegans. In partnership with the San Diego County Office of Education, we created a Live Well at Home webpage where people of all ages can go for resources on staying both physically fit and mentally fit over the coming weeks. It has videos, tutorials, and information for groups of different ages to exercise their bodies and their minds. This new resource can be found on our COVID-19 webpage, which is coronavirus-sd.com. That's coronavirus-sd.com. I urge you all to check it out. And again, remember, San Diego, live well, in order to stay well, stay home. This concludes our media briefing for today. We'll be back here at 2:30 tomorrow. Thank you.